Hi, it's Dr. Adrian from Dental Artistry here in West Perth. Treatment of failing implants. Well, there's a lot of research that has been done on failed implants, and really it's a bit difficult because there's not a lot of consensus when it comes to treatment of failed implants. But the most important thing is really just picking up early. We also talked in the previous video of the stages of a failing implant. We of course go from a healthy implant that has been in the mouth for many years, looks great cosmetically, and of course functions just like a normal tooth, all the way through to what we call mucositis, which is inflammation of the gum around an implant, through to peri-implantitis, which is inflammation not only of the gum, but destruction of the bone, all the way through to failure of the implant. When we talk about mucositis, the most important thing is of course getting an x-ray of the area. Generally, we'll notice that there's bleeding around the implant and definitely bleeding on probing. There is sometimes a lot of redness around the gum around the implant because this is inflammation, of course. We would always take an x-ray and basically check that there's no bone loss. And this is very important because bone loss, of course, is a more advanced form of failure. We really want to check the overall hygiene of the patient, make sure the patient's bleeding really well, make sure they're cleaning just generally around their mouth. The third thing really is we have to remove the crown or the superstructure because this allows for much better cleaning. There are a lot of cases where when we remove the crown, we find that there's cement or debris around the crown that's actually causing this. The other problem we also have is if the crown has not been shaped correctly, we find that we could get a lot of buildup around the implant, and this can actually lead to problems. Also, if the placement of the implant is not right, we will find that there's a lot of redness of the gum. So we remove the bridge, we will clean around it, really get access surgery so that we can really look and see and make sure that everything's fine. In certain cases, we may need to do some sort of grafting of soft tissue to improve the gums. We then put the patient on chlorhexidine and antibiotics, and we monitor the patient really well, not only for that area, but to ensure that the patient's hygiene is actually excellent. The second type is what we call peri-implantitis, and this is when we're getting problems with the bone around the implant. We will normally find that there's pain, there's some swelling, redness of the gum, and there's always bleeding, not only on brushing, but also on probing by the dentist. Again, the first step is x-ray, sometimes a bone scan of the area. We normally remove the superstructure, so what we're doing here is we're removing the bridge, and we really want to check the implant without the bridge being in place because we can clean around it better and we can visually see what's actually going on. There's always draining of the infection, of course, to make sure it's clean, and there is certain situations where we have to do surgery. And the surgery really depends on the classification of the defect, the bone loss around the tooth. The classification sometimes it goes by different walls. If we lose 1 or 2 walls of bone around an implant, we can do what we call a resection, where we're just removing some of the bone in order to actually allow for cleaning. In certain situations though, where we've lost more, maybe 3 or 4, we have to really consider grafting in these areas. And although when you look at research, there's no papers that are saying that we're definitely going to get bone reattaching, we know that the results are better if we place bone, whether natural or artificial bone, back into the defect. We then can improve the soft tissue around the area, and this helps the patient, of course, clean and maintain this area better. We, of course, put the patient on chlorhexidine mouth rinse and some antibiotics during the healing phase, and then again, it's monitoring the situation really well. There is limited research when it comes to treatment around failed implants and what actually works and what doesn't. What we do know though is that if we do clean a defect out and place bone, the results are always better than actually leaving or just doing a clean of the area only. The most predictable result is, of course, long-term oral hygiene and really making sure that the patient has the ability to clean around the implant properly. And this could be altering the superstructure, so actually changing the shape of the crown or the bridge that is on top of the implant itself. And sometimes, unfortunately, the only treatment is actually removal of the implant because the infection has gone so far. When it comes to failed dental implants, the most important thing is to discover it quickly. If you can actually discover it in a very early stage where it's maybe just the gums, it is much easier to treat than, of course, if there is bone loss. If you have any questions, please give us a ring at 1-800-SMILING. I look forward to one day seeing you in the practice.